Here we are 1 month out from a tummy tuck, and so far everything looks good. But I want to show you something that is a little bit, I don't know what's going on. I do know what's going on, but I want to show you. So our incision looks really good. Everything's going well. Everything's great. But we have a small little area here of redness. Nothing is really happening so far, but you get the idea that maybe there's something brewing there. That could be what we call a little stitch abscess. So every once in a while we'll have a patient in a tummy tuck. It happens most commonly in a tummy tuck, but it's a type of stitch that we use. It's a vicryl or monocryl, and your body can have a little reaction to that. It's an absorbable stitch. Your body is going to, just through the water, dissolve that stitch. But sometimes patients can develop a little local inflammatory reaction and a little local low-grade infection there that'll just kind of open up, and you might even see a little bit of pus there. It's not a big, huge global infection. It doesn't have an abscess. And in her situation, we're just going to sit by, and if this just heals and goes over, which quite often they do, then there's nothing for us to do. But if it doesn't, then the natural course of this is that little area will open. There'll be a little bit of pus will come out. And then if she comes into the office, we'll just take a little pair of tweezers. We don't call them that, but we'll take a little pair of tweezers and we just remove that little stitch, and then that solves the problem. No antibiotics are needed. This is not really what we consider any type of major infection. It can happen, and if it does happen, typically we do see it in more of this midline area. It's not as common to see it towards the outside area, but it's possible too. It's not just with plastic surgery, but with any type of surgery. And I know personally, when my wife had C-section many years ago, I used to have to take some of these little stitches out of her because she was spitting almost every one of them from her C-section. And so then we had our twins about 3 years later, and I went into the operating room with my wife, and I was talking to her surgeon who did her first surgery. And I said, hey, I spent about 6 months spitting stitches out. So, use a different material than you used last time. He's like, oh, I usually use vicryl. I said, well, that's what I do. And he said, well, let me change it to monocryl. Well, I spent another 6 months spitting monocryl. So some patients have more of a propensity to spit stitches than others, but it's not anything to be concerned of. It doesn't have any major impact on the scar, and it's not some huge infection. So if you see it, don't panic. Just see your surgeon. Go in. They'll know what it is. They'll just pluck the little stitch out, and then everything will be all done.